If you have numbness, tingling, or pain over on the pinky side of your hand and down into your elbow, you're in the right place because the exercises I'm going to show you in this video can help you to fix it. My name is Dr. Jared, and this is all about ulnar nerve entrapment and cubital tunnel syndrome. Now, what in the world do those mean? Let's talk about the ulnar nerve first. Basically, you have a nerve that starts in your brain, exits your neck, and goes all the way down your hand into the tips of these two little fingers over here. If that nerve gets pinched or irritated anywhere along that path, it can cause those numbness and tingling and pain symptoms to show up on the side of your hand. In this video, we're going to talk specifically about the cubital tunnel, which is a narrow passage right here at your elbow. If that ulnar nerve gets trapped in that cubital tunnel, it can cause that reproduction of those symptoms out here into your hand. So if that's your case, you're in the right place. These are the exercises that are going to help you to fix it. The first thing that we have to do is rule out your neck as a source of these symptoms. If this pain, this numbness, this tingling is coming from an irritation or a pinched nerve in your neck, no amount of work at your elbow is going to help it to feel better. And so if you get these symptoms with neck motions, or if your neck is painful, those are two good signs. What I like to do is actually try to pinch the nerve in the neck to see if I can reproduce those symptoms. That's a good way to tell exactly where this irritation is coming from. So what I want you to do, let's say that my painful side or my irritated side was here on the right. I want you to look up at the ceiling. I want you to tuck your right ear over to your shoulder, or the affected ear over towards the affected shoulder, and then rotate your head away in this direction right here. And what that does is that really pinches down on that cervical vertebrae. If that causes a reproduction of those symptoms, then you have a cervical neck nerve entrapment rather than the cubital tunnel elbow entrapment. And of course, I've got you covered in a video for that as well. I will link that one below in the description. If that does not reproduce your symptoms, but you can bring your arm into this position and kind of tap right here on the inside part of your elbow, and the more you tap, the more you feel that, the more irritated it becomes, that's a pretty powerful sign that it is this cubital tunnel that we need to address. And so in that case, here are the exercises. The first thing that I always start with is going to be a massage to this area. It's a great way to promote blood flow, promote relaxation, promote mobility. And so I typically spend most of my time focusing on the muscles of the forearm. Use a little bit of lotion, a little bit of lubricant, and so that we can really massage and work over these muscles right up here in the forearm. Sometimes with some people, I will go in through that cubital tunnel and I'll kind of massage around the elbow. But please keep in mind that that can cause those symptoms, that can light up that nerve, which we don't want to do. We don't get rid of nerve irritation by irritating it more. So keep that in mind with all of these exercises. It's a fine line that we have to walk. We want to promote healing, but we don't want to induce irritation. And so about 2 to 3 minutes of massage, again, to the muscles of the forearm, up here through the elbow, if you can tolerate it, just to get things loosened up. Next, let's get into some active range of motion exercises. We basically need to address the muscles that are above the elbow and the muscles that are below the elbow. And so really simple, what we're gonna do is with that affected hand, let it hang to your side, keep your thumbs up, and then point those thumbs up to the ceiling while we're gonna bend our elbow right up here and then right back down. And on this, super easy, 20 to 30 repetitions, just a slow, comfortable pace. And again, the goal is to just work in a little bit of some pain-free motion at the elbow, get some blood flow into that area. That's number one right there. And then let's address the muscles that are below the elbow, which are going to be the muscles of the wrist and the hand. And so the way that I like to do this is we're gonna rest it right here. You can rest it on a table, you can rest it on an armrest, you can rest it on your leg right here. Just go palm up so we don't have pressure on the inside part of the elbow. And then from here, what we're gonna do is pull our fingers back down towards the ground and then lift our fingers up towards the ceiling. Super easy, super comfortable, but you're gonna feel these muscles in your forearm working and going crazy while we do that. And again, super easy, 20 to 30 reps is a good number to shoot for. And then we also have muscles that control our grip that originate right up here on that elbow as well. And so you can open your hand up wide and then close your hand just like this. Again, nice and comfortable, 20 to 30 repetitions, just to get some active motion and to promote normal movement in that whole area again. And then after that, I like to follow that up with some stretching. And the stretching that I find to be the most effective is going to be some stretches for your wrist flexors right here. And so if you bring your hand into this position and then pull your fingers up towards the ceiling, depending on how irritated that nerve is, that might even be a good first place to start right there. I'd hold that for about 10 to 20 seconds and then come right back down. If that feels okay, if that's not causing too much irritation in the nerve or too many symptoms in your hand, what you can do is get your other hand, hook it right here around your fingers, and then apply just a gentle pressure back in this direction, back towards your shoulder. And so we're introducing more extension in the wrist. It's a greater stretch to these forearm flexors right here. And I want you to pull on that as far as you can comfortably. So again, keep it super comfortable. Consistency over intensity, meaning I want you to do small stretches more consistently throughout your day rather than one really big intense stretch. That's typically the way that things go. And so on this, about 20 seconds repeated 3 times. I do like to do a wrist extensor stretch as well. So we bring our hand down into this position and pull this direction right here. That's going to stretch these muscles here on the top, or on the back side of your forearm. But what we can do is 20 to 30 seconds in each direction, repeat that 3 times, just until everything feels loosened up and comfortable in your forearm. Now, in my experience, this last exercise is one of the most effective things that you can do to eliminate these ulnar nerve symptoms at this cubital tunnel. But before we jump into it, how has this been? Leave a comment down below. Let me know how you're doing. If you did like this video, hit the thumbs up button, and thank you so much for your support. These are going to be ulnar nerve glides, and I want to show them to you in 3 phases. And basically, we have to be able to do phase 1 pain-free before we move into phase 2, because they get progressively more aggressive. And so if you can't do phase 1 pain-free, you're definitely not going to be able to do phase 2. So use that as a sign of progress and use that as a mark of improvement. And so phase 1 looks like this. We're just going to bring our hand straight out to the side, just like this, palm down. And now what we want to do is just extend the fingers kind of back towards your head, up towards the ceiling, and then right back down. Now, if your pain is really acute and if it's really sharp, if there's a lot of impingement going on down there, this is going to be about as far as you can go. I want to cause some stretching. There might be a slight reproduction of pain, but I don't want it to be especially irritating. Nerves are kind of difficult to treat in that we don't want to push them too hard too fast, or else it can take some steps backwards. And so only about a set of like 10 to 15 reps on this, just pushing to the point where it feels like it's that reproduction of those symptoms. Hold about 3 seconds and then come right back down. That's phase 1. If that feels okay, phase 2 would be to get into the wrist extension position, but now we're also going to introduce some flexion at the elbow. So now I'm going to slowly bend my elbow up just until I get a reproduction of those symptoms again. Hold that for just a couple seconds, about a 3-second hold, and then all the way back down to the starting position. And so extend at the wrist, flex at the elbow until we start to get those symptoms right about there, and then hold 2, 3, and then come right back down. It's important to mention that even I feel this. If I really crank on that, I can actually get a little bit of some symptoms down into those fingers. So again, it's not one that we want to push too hard. And so that would be phase 2. And then phase 3, we're actually going to add some neck movements into this to promote more of what we'd call a flossing technique. So like nerve flossing. Basically what we're going to do is take 2 sides of the nerve and then move it through the irritation. And so let's do phase 2 again. So we're going to come extend at the wrist, and then we're going to bend at the elbow as far as we can. But now, as we're lengthening the nerve here at the elbow, I want you to tilt your head over towards your hand. And so that's shortening the nerve up here at the neck. We're going to hold that for 3 seconds, and then we're going to extend the elbow and then come down with the wrist as I lean my head the other direction. And so now we're relaxed here, but we're increasing the tension here. And so then that's what it looks like. Hold 1, 2, 3, come back to neutral. We're going to get into this position again, over towards the hand. 1, 2, 3, and then back, and then down into this position, and then extend away from it. 1, 2, 3. And again, about 15 or so reps is a great number to shoot for. I hope these help your hand and your elbow to feel better, and thank you so much for watching.